Diabetic retinopathy is a complication of diabetes mellitus. And nowadays, the number of diabetic people are increasing to a great extent. Maybe because of lifestyle or habits or food style or mental stress. So many reasons are there behind this. Still, anyway, the number of diabetes mellitus, the number of people are increasing. So the complication also is increasing. Diabetic retinopathy is a complication of diabetes. But this is very important because that touches their life, their future or their confidence, everything. If there is a visual defect, that will that will be making very serious impact on their life. Because anyway, it is already proved that more than 80% of knowledge we gain is through our visual organ. So if there is any defect or any problem with this structure or with this sense, then our life will be totally upside down. So it is a responsibility or duty to protect our vision. So this treatment of retinopathy also becomes very important and very serious. Retinopathy is a condition where vision will be seriously affected. One main symptom of this retinopathy is the leakage or bleeding from the blood vessels. That is because of so many other reasons. Diabetes directly affects the vascular system, especially microvascular system of the body. So the microvascular system of the retina also is involved in its pathology. And if that person is doing too much eye strain works or having so much mental stress, then the possibility of developing this retinopathy is very easy in a diabetic patient. Now coming to the bleeding, bleeding section, that is the leakage from the blood vessels. The leakage may be due to different reasons. One main reason is a block in the vessels, blood vessel, maybe in the artery or vein, mainly venous system. And second is a constriction of the vessels or some changes in the vasculature, blood vessel or blood walls, like that. Whatever may be, whether it is a block or a vascular change or constriction, there will be a block or a block to the blood flow. This is the basic factor for leakage. So if there is a leakage or there is a bleeding, the first attempt in the treatment should be to arrest the bleeding. Once it is bleeding, then it will change it to clot and then make opaque deposits and vision will be seriously affected. So before that, the bleeding tendency should be controlled, it should be arrested. For that, nowadays different methods are there, laser and photocoagulation and injections like that. But even though we are arresting the bleeding or arresting the leakage, the reason for the leakage is still there. So what happens? It will again occur. It will occur though. So once we are arresting that leakage by mechanical procedures, it will happen again because that pathology is still remaining in the body, in the retinal vessels. So in Ayurveda, before arresting this vessel, this bleeding point or the leaking point, we are isolating the reason for that and taking some remedial measures to maintain it. That is to maintain the blood circulation. If we are making the flow correct or making the flow in a better way, then the possibility of this accumulation of the fluid inside the vessel and the leakage can be controlled to a great extent. Then even though we are arresting it for temporary, by any other methods, further leakage can be controlled. So in Ayurveda, in our hospital, we are touching the circulation first. For that, there are different methods, different treatment procedures and different medicines for intake, etc. to maintain the circulation. After that, the next step should be to remove the accumulated fluid, or the already leaked fluid will be accumulated in the retinal layers, or it may be lead to the vitreous fluid. To remove that is the next stage. So, before starting the laser, if we are laser means to arrest the bleeding point, if we are doing something to maintain the circulation, that will give better results. That can be done in Ayurveda. If there is a tendency of leakage, sometimes what happens, it is not leaked, but the vascular changes are there which may lead to leakage. At that stage, if you are starting the treatment, that will give very good results, and we can avoid laser treatments or arresting type of method, mechanical methods for its management. So I will always advise to do something to maintain the possibility of the pathology, developing the pathology, especially of the leakage. That will be more important or more fruitful than giving some temporary results. Once this leakage or hemorrhage is arrested, it is now clear that there will be this occurrence of it again, because it will bleed from another point, because this pathology is still there in the vessels, so it will again happen. So in such situations, we have to do some treatments to avoid further leakage or further developments. And then what happens, if you are doing these vascular changes or laser again and again, that points will be inactive. So the vision will not be improved. After one stage, even after repeated lasers, I will say here one more point. Usually diabetic retinopathy people come to Ayurveda in 3 different stages. First one, they will be asking me, I am diabetic for such and such a period, and now there is a blurring, some defect in my vision. So the doctor told you have to go for laser immediately. That is one group of people. Second is, they will be saying, I am a diabetic retinopathy patient and continuing with the laser treatment. Now I am fed up with this laser because there is not considerable improvement in vision even after laser. So they are inquiring whether there is any method to avoid further lasers. Third group, they will be saying retinopathy was developed in one eye and was under repeated lasers, and finally one major surgery was done, and even after that they didn't get the desired results. Now the same changes have started in the other eye. So I want to protect this eye, whether there is any method in Ayurveda. These are the 3 main groups that are coming to I will say to me, or to an Ayurvedic doctor. So in these 3 sections, the treatments are different. In the second stage, the first stage I have already explained now. In the second stage, if they have already done 2-3 these lasers or injections and again address for the same, then we have to go to the basic or root level etiological factor first. Which habit or which food items or which food lifestyle is developing this reason again and again. That is to be tested first. Second thing, we have to control the pathology that is leading to leakage, that is vascular change, or sometimes the deposits in the blood. There are different kind of the cholesterol level or hypertension. These are all influencing factors. That is all to be rolled out. In the eye, we have to maintain the circulation. Then only the further leakage can be controlled and the other laser can be avoided. Later, if there is some problems in one eye and different mechanical trials are already done and didn't get any desired results, they will be getting temporary result and they are asking for the protection for the next other eye. So we will always advise to do something as preventive for the other eye, because the basic or root level cause is diabetes. It is still there. It is still there means it may be sometimes control the blood sugar level by insulin or by tablets or food style, etc. But that means that diabetes is still there. It is only maintained or managed by some methods. If so, the possibility of developing the complication is still there. So it is our responsibility of the patient and the doctor to protect the better eye, to avoid further development of complications in the other eye. For that, there are very powerful, very fruitful medications and treatment procedures in Ayurveda. It involves different types, that is internal medicines are there, ophthalmic medications are there, and extraocular methods also are there to control this development of complications, ophthalmic complications in the eye, and thereby protect the vision. That is sure.